Good afternoon, and welcome to today's webinar, From Kitchen to Clinic, Practical Applications of Culinary Medicine. I'm Leslie Sine, Director of Professional Development at Great Valley Publishing, and I'm your host for today's show. Before we get started, I have a few points of housekeeping. First, to claim your credit, you have to stay with us through the entire hour-long presentation. Second, at the end of the presentation, our presenter will be taking questions. If you have a question, please type it in the Q&A box on the left-hand side of your screen. We'll try to address as many questions as time allows. Leah Sarris, MBA, RDN, LDN, faculty for this event, has no relevant financial relationships to disclose. Today's webinar is brought to you with support from the California Strawberry Commission. The CSC represents more than 400 strawberry farmers, shippers, and processors, proudly working together to advance strawberry farming for the future of our land and people. Through science-based information and education, CSC delivers the good news about sustainable farming practices that benefit the health of people, farms, and communities. Visit californiastrawberries.com to learn more. And now I'm pleased to introduce today's webinar speaker. Leah Sarris is an educator, chef, and dietitian with over 15 years of experience in innovative industry training, strategic planning, and program implementation. With an MBA from Tulane University and a BS in culinary nutrition from Johnson & Wales, her wide-ranging professional experience spans from food service to agriculture, education to administration, and community engagement. Leah helped pioneer the culinary medicine movement by developing and implementing the United States' premier interdisciplinary culinary medicine program at Tulane University, which is now being used by over 60 medical schools across the country. In her current role as Director of Culinary Marketing and Education at Wild Hive, Leah brings a unique combination of culinary education, culinary medicine, and business acumen to develop and implement innovative educational experiences that showcase clients' food products to a diverse range of stakeholders. Leah is a certified culinary medicine specialist and currently serves on the Culinary Medicine Specialist Board, as well as the board of Sprout NOLA. Leah is particularly excited to provide professionals and community members alike the opportunity to learn how to create and eat great food that just also happens to be good for them. And so with that, I'm pleased now to turn it over to Leah Sarris. Welcome, Leah.
Thanks so much, Leslie. I'm really happy to be here. As Leslie said, I have no financial relationships to disclose. And for the learning objectives, I'm not going to waste time on these. You do have them in your slides to refer back to since we have a lot to cover. All right, diving right in, let's first define culinary medicine. Culinary medicine is about blending the art of food and cooking with the science of medicine to provide practical recommendations to patients that implement healthy ingredients. It's a food-first approach, which means we're going to talk about food and not nutrients. And with that, the food, of course, must look and taste good. I do want to iterate that it doesn't promote food replacing medicine. In fact, nutritional interventions alongside medicinal interventions can often have a synergistic effect where 1 + 1 might equal 3. However, there are times when nutrition interventions can alleviate or eliminate the need for medication completely, which is great, but that is solely determined by the healthcare team. This approach is evidence-based and multidisciplinary, which I'll delve into more, and I believe ultimately it strengthens the role of the RD as part of the healthcare team. As we define culinary medicine, I think it's also important to talk about food as medicine, which we are hearing about more and more recently. Food as medicine is a looser and perhaps more controversial term. We've heard a lot about it recently as it's gained traction from the White House Conference on Hunger, Nutrition, and Health. But in general, food as medicine pertains to nutritious food's role in sustaining health and preventing disease, promoting food security, and in treating or managing disease. Food as medicine initiatives often focus on medically tailored meals, medically tailored groceries, and produce prescriptions. And while some organizations, such as the Academy, have been trying to put a standardized definition to the term, I'll say it can become a bit like the Wild West at times. So we need to pay close attention to products and companies touting the food as medicine term to ensure they meet our nutrition and taste standards. Culinary medicine is a movement that has been growing a lot over the past 10 or so years, and some might consider an arm of the food as medicine movement. Organizations such as Harvard, alongside the CIA, and Tulane, which has grown into the Health Meets Food program, which I'll talk about more, have been leading the helm, with the first teaching kitchen opening at the Tulane Medical School in 2013. This is the program that I was involved in helping to build. That program evolved to Health Meets Food and is now being utilized by over 60 medical schools across the country. Additionally, the Teaching Kitchen Collaborative has grown with more than 48 member organizations, which I'll touch base on in a few. Recently, in 2022, the White House Conference committed over $8 billion in private and public sector commitments to end hunger and reduce the diet-related disease. They focus on 5 pillars of food as medicine, and medical education falls under pillar 2 for that initiative. The reason why we're harping so much on medical school education is because it's really, really needed. Medical students only get an average of 12 hours of nutrition education. And when they do, it's purely clinical. They don't know how to talk about diet or food. So while the doctor may be able to tell the patient to increase fiber in their diet, which let's be honest, we're lucky if they even say that, they don't know how to tell patients how to actually do that. And it's not their fault. They just aren't learning it in school. However, diet-related disease is a huge cost burden to the system. In the U.S. alone, we pay $1.72 trillion per year, which is equivalent to 9.3% of the U.S. gross domestic product toward diet-related disease. And this was in 2019, so I expect this has grown exponentially since. In this culinary medicine spectrum, you can see that culinary medicine doesn't end with physician education. On the outside of this, you can see that all members of the healthcare team, including nurses, physician assistants, and even dentists and pharmacists, have a vested interest in improving nutrition for their patient population. And let's be honest, even RDs can employ more practical culinary proficiency when guiding patients. In the center here, we can see multiple methods of deployment of culinary medicine. First is teaching kitchens, which can be embedded in medical schools or in clinics or hospitals, or sometimes can be embedded within the community. And those can be either in-person or virtual and teach people practical hands-on applications of culinary medicine. Second are in-person counseling opportunities, which of course we're familiar as RDs in this spectrum, but as I'm talking about, this can expand to the rest of the healthcare team as well. And fortunately, we're getting more opportunities to do this with telemedicine and e-consults, which I'll touch on in a few. And last, we are seeing increased research initiatives as interest grows in the culinary medicine realm, which was another key area of the White House Conference. This is no surprise why we need to do this. People don't know how to cook anymore. They lack confidence in the kitchen. A lot of times we call culinary medicine home economics for the 21st century. Low kitchen confidence leads to poor diets. We need to show people that healthy food should look good, should taste good, and be good for us all at the same time. We also need to move from reactive to proactive medicine by focusing on diet and lifestyle. And in the end, we're going to see huge health and cost savings for both the patients and the system. The Global Burden of Disease study shows that low fruit intake is one of the top 3 contributing factors to diet-related deaths globally. Additionally, in the U.S., about 1 in 10 adults actually meets fruit and vegetable intake guidelines. We need to update our approach and focus more on practical applications so that we can move the needle in a positive direction, because this is obviously very alarming. I'm going to give you a few examples of how culinary medicine initiatives are being carried across the U.S., the first being at Boston Medical Center, which has 3 approaches to culinary medicine or food as medicine. The first is through a teaching kitchen, where they're teaching medical students, residents, and the community. They also have a food pantry that serves about 7,000 people per month who are screened in their outpatient clinics and referred by physicians after they may be screened for things such as food insecurity. And they can actually pick up that food while they're at the hospital. Additionally, they have a rooftop farm that produces about 6,000 to 7,000 pounds of vegetable per year, 70% of which goes to their food pantry, and the rest of which goes to their cafeteria and the farmer's market for their employees. At the Bouldering Center for Culinary Medicine that's here in New Orleans, They have required sessions for both first and second year medical students, and they have additional opportunities with medical students throughout their 4 years through electives and interdisciplinary seminars. They have a 1 month culinary medicine rotation that they can take during their 4th year of medical school for both Tulane students and visiting students. And for the community, they offer hands-on classes for adults, kids, and families alike. Additionally, they host dietetic interns and culinary interns for a month at a time. So you really see the interdisciplinary work coming out here with culinary, dietetic students, and medical students all working together. UT Southwestern is a teaching kitchen that does a lot of similar things I just mentioned, but they also have an e-consult service, which I mentioned earlier. That's a peer-to-peer consultation within the clinic that gives RDs an opportunity to coach doctors and other healthcare professionals on how to approach nutrition and diet with certain patients internally. And this is billable in a lot of instances. There are a few really good resources out there for you if you're interested in learning more about culinary medicine. First is the Health Meets Food program, which is that program that started at Tulane. They have both in-person and virtual learning opportunities, as well as a certification called the Certified Culinary Medicine Specialist if you're interested in becoming certified. The Teaching Kitchen Collaborative, which is an initiative between Harvard and the CIA, is an online platform that people who may have a teaching kitchen or are interested in opening a teaching kitchen can find resources to do so, as well as an in-person learning opportunity through Healthy Kitchens, Healthy Lives. The Chef program is a 2-part program focused on culinary coaching, which improves nutrition through culinary training, combined with health coaching principles, and that's a virtual program. And the American College of Lifestyle Medicine, or the ACLM, has a free 5.5-hour culinary medicine course that you can access through their website as well. Research in this area is limited, but it is growing. And as you can see here, for medical students, we are showing an increase in knowledge. In a review of 12 medical schools, we saw a dramatic improvement in their knowledge of healthy cooking strategies, meal planning, and culinary skills. As well, they also feel more confident in discussing nutrition with patients. Those who didn't take the course only had 29% confidence versus those who did have 92% confidence in discussing nutrition. Additionally, and I think this is really important, they have an increased understanding of the role of dietitians in patient care. Those who didn't take the courses only had a 37% understanding of the role of RDs versus those who did have a 93% understanding of the role of RDs, which, to my point, I think really strengthens the role of the RD in the healthcare system. For patients, we've seen an increase in fruit and vegetable consumption. They report less difficulty in preparing healthy food. They cook more from scratch, and they report increased self-efficacy in meal planning and cooking. There are a lot of challenges in this arena. First, a lack of definitions, as I mentioned before, and applications of culinary medicine make it hard to measure the effects of interventions. We obviously need policy and health insurance reformed for increased coverage and billing options for nutrition interventions. And ultimately, I think you all agree, we need to make it easier to see a dietitian. There's limited research in this arena, as I just touched on, to prove its efficacy. And in medical education curriculum, there's limited space to teach nutrition, and there's also some reform needed to mandate it within that realm. But by far, the biggest hurdle is a lack of funding to build and sustain culinary medicine programming. I hear this as a challenge across the board. We know that fruit and vegetable intake is a huge issue with our patients. So I'm about to jump into a cooking demo showing how to incorporate more fruits and vegetables into the diet by starting small in areas that feel comfortable to patients and utilizing a few ingredients throughout multiple dishes. I'll touch on those more during the demo, but in the end, if you have an opportunity to prepare and taste food so people feel less intimidated by it, it opens up a whole new window of opportunity for intervention, which is really where culinary medicine steps in. For the demo, I'll prepare 3 delicious dishes incorporating culinary medicine principles. with a common ingredient weaved throughout, delicious strawberries. While valuable, it is a bit longer. I'll just warn you, it's about 40 minutes. And but we will have a little time for Q&A after. The recipes for this are provided as part of the packet, and with that, we can roll right in.
Okay, now we're in the kitchen and we are going to make 3 really great strawberry dishes that incorporate California strawberries, but are also really great examples that illustrate culinary medicine principles. And as dietitians, I think we hear a lot about barriers that people have to healthy eating. And one that I hear a lot, that I'm guessing you also hear a lot, is that people buy all of these fruits and vegetables only for them to go bad in the fridge. And that's a problem. I mean, it's wasteful for the environment, it's wasteful for their pocket. A lot of people have trouble affording, anything. So we want to make sure that they do it in a way that's affordable, that's sustainable, that's not wasteful. And a lot of what I focus on with that is cross-utilization and also starting small. So let's focus on getting people to just incorporate a few ingredients at a time and finding multiple ways to use them, which is a lot of what I'm going to do today with strawberries. So with these gorgeous strawberries, they're in season. They are actually, you can get them year-round, but right now, May is National Strawberry Month. So it's a perfect time to celebrate delicious, gorgeous, super sweet, beautiful strawberries from California. Fun fact, by the way, 90% of the fresh strawberries that we enjoy in the United States are from California. And we are going to do these, you can just eat them on their own. Let's face it, strawberries are delicious. They're America's first love. I think you can probably agree with me. As a kid, this was literally the first fruit that I enjoyed, and we would always have it in the fridge, and I could just eat them. I would eat them by the cupful pretty much daily. By themselves. I didn't need much, but I also want to show you ways to use them in fun and exciting new applications, both sweet and savory, different meal parts, so they don't have to go bad in the fridge. And like I said, find multiple ways of using a few ingredients. That's the name of the game today. You're gonna see some ingredients that I use over and over again in multiple recipes. It's that cross-utilization, and that way people don't have to buy too much food at once. And don't forget, when we're talking about fruits, vegetables, incorporating healthier ingredients into diets, to provide resources to your patients. Recipes, handouts, work on shopping lists together. Sometimes just saying eat more fruits and vegetables isn't enough. So that's really where the culinary part of culinary medicine comes in. We want to make sure that they feel comfortable actually applying what you're talking to them about and incorporating the ingredients that you're talking to them about getting. And last but not least, as I'm cooking today, I want to do something novel for you. I want to showcase new ways you might not have thought about using strawberries, maybe some new cooking techniques. Not keep it, I don't want this to be boring. So I did some fun and exciting things here. However, I do recognize that not everything I use, not every method I use here today is going to be approachable or maybe not even enjoyable by everyone. They may not have the skill set to do it. They may not have the money for some of the ingredients. They may not have the time. So everything here you can change. You can substitute ingredients. You can add, different methodologies and techniques to make it approachable to you, to make it approachable to your patient. And I will do my best as we're going through to acknowledge those substitutes and say things that we might do to make things a little more approachable. So with that, the first recipe that we're going to do, actually we're going to start with some of the prep, so what I would call sub-recipes, some of the ingredients that we're going to use over and over again as we are making the rest of our dishes. So there's always prep. Prep is always the biggest part of meal preparation, right? So first thing I'm going to do is toast some sliced almonds here. You can use slivered. You can use other nuts. You can use seeds, pumpkin seeds. I love pumpkin seeds. You can toast all these in the same way. You don't have to use almonds. This is really, you can swap out any number of seeds or nuts in this application. I'm using almonds because I think they go really well with strawberries. And all I'm doing is getting a pan hot back here. No oil, we're doing this dry. And I'm dumping my nuts right into the pan into a single layer. And you don't need oil because the oils from the nuts themselves are going to be released. And you want to keep a close eye on this because it will go from toasted to burnt very quickly, and you want to move them around. And so your flame should be medium high. Do this a little more slowly, get them toasty. You can also do this in the oven, in a 350-degree oven. Just lay them out on a sheet tray and keep a close eye. Again, it goes from toasted to burnt very quickly, which all of us that have done this have done more than once, I promise you. While those are starting to toast, I'll show them to you when they're done. I'm also going to put on my next ingredient, which I'm going to do pickled red onions, which it's a quick pickle. So it comes together very quickly. It's not a traditional pickle, it's a quick pickle. And you can pickle pretty much anything. Actually, I'm going to show you a little lagniappe ingredient. Lagniappe is what we say here in Louisiana for a little something extra. So we have a new star ingredient today. Also, just for the fun of it, I'm going to show you some pickled strawberries. You can pickle pretty much everything but the kitchen sink. So a number of fruits and vegetables, you can do a quick pickle too. But we're going to do pickled red onion. And to this cider vinegar, you can use any number of amounts of vinegar, white vinegar. You can use red wine vinegar, white wine vinegar, whatever you have on hand. I like cider for this application, but I also like rice vinegar and other types. I'm going to add salt. It seems like a lot, but remember, most of it's staying in the brine. It's not like you're drinking the brine, so you don't need to worry about that. And I'm also going to add some water to it. And in the recipe I put you can add sugar if you like. A lot of pickling recipes have sugar in them. I like the acidity. I find I don't need the sugar per se, but you can do that if you like. So it's an option. You can add any amount of spice, black peppercorns, pickling spice, herbs, to get that flavor that you want in here. I'm going to just keep it real simple for today. And I'm just going to put this on the stove. I'm also going to give my nuts a little toss, make sure I don't burn them. And I'm going to bring this to a simmer. Just enough I can start to smell the nuts, which is good. That's what I'm looking for. I just want to really dissolve the solubles in there, dissolve that salt. So while that comes to a simmer, and keep an eye on my nuts. Again, once they start to toast, doesn't take long. I'm going to cut a red onion. I'm going to julienne it. To julienne it, I'm going to cut off the root end and the end that's opposite from it. I find a lot of people automatically go to cut the onion in half this way. I'm actually going to tell you to cut it in half the other way through the root. So cut off the ends of your onion, cut it right through the center. You have those flat surfaces to work with. I always have a little trash bin at my station, so I don't have to go to the trash can. And I think we've all probably done it, where you're standing over the trash can, peeling something, and you drop it in there on accident. We don't need that. And I'm going to peel off my skin. And then I'm going to cut with the lines of the onion. I have a finicky. I love these, a little bench scraper here. You just scrape up, or bowl scraper. Check on mine. Ooh, it's starting to get toasty. Turn this down a little bit. These are great for scraping up things off your cutting board. Okay, so I find a lot of people will cut this way on the onion, but when you do that, you get the little pieces in the center and the bigger piece on the outside. To get a more uniform cut, you want to cut with the lines of the onion. So that's what I'm going to do here. Just flip it on that wider edge when I get to it. Flip it on the wider edge. Great, we have a nice julienne onion. Check on my nuts, I think they're about done. A little longer, turn it down a little more, I don't want to burn them. I'm going to put these onions right into this container. I love these little pint containers, quart containers, because they just are the similar size, they stack. They go in my fridge. I don't have to worry about having a bunch of different sizes. And I'm putting that to the side while I'm waiting for my liquid to come to a simmer. Okay, my nuts are nice and toasty. You can see those, I hope, in that can there. And I want to take them out of the pan because they will continue to cook and they could burn, which we don't want. So just scrape them right into a container. They will stop the cooking process. Then we're going to utilize these across the board. That was really simple. Toasted nuts. Put it in your repertoire if you don't have it there already. All right, put those to the side. And then next I'm going to, while my liquid, just check on it, is coming to a simmer, I'm going to roast some strawberries. And you can use any strawberries. These are fresh and delicious that I'm using today, but I just rinse these in the colander. You don't want to wash them until right before you use them. This is also a great way for you to utilize if strawberries are starting to turn a little bit. You need to use them up. Roasting is a great way to use those strawberries. Anytime. But we want to avoid that waste as much as possible, so I am, if you notice them turn in the fridge, go ahead and roast them. Roast is a great option. So I'm just going to, I don't need to take much off for the green part. These shouldn't have much white this time of year anyway, but if they did, I don't need to cut that off because they're going to get roasted and be in a nice kind of syrup when they come out. So really just cutting off the green and having them. These are smaller berries. You can keep them whole. You can quarter them. I like the texture and color that it does, the way it looks when I do them in half. So that's what I'm going to do for today. It's just a quick halve. And if they're really small, if you find like you get a small one, you can just keep that whole. The trick is you really want to have them somewhat uniform shape in the end. Got to have some of them. There we go. And this is for about 1 container of strawberries that you might get at the grocery store. But you can adjust the recipe. I try to make it so you can adjust it up and down based off how many you have. But if you've never roasted strawberries before, you are in for a treat. I really like them. And like I said, you can freeze the roasted strawberries once you've cooked them, freeze them, and save them for later. And you have a quick addition to add sauces, to add to breakfast dishes that we are going to show you a few options here, but we can talk about a few other options as well. Okay, so now we have our half strawberries, and I just have a baking dish. And my liquid is simmering now, so I just turned it off for my pickling liquid. All right. I am going to put in my half strawberries. Dropped a half. It's okay, I'll get that later. A touch of sugar. I do want to add, this is completely optional. Some people are really sensitive to adding sugar. I think, I think a little bit of sugar has a place in the pantry. And I find it highlights the sweetness in the strawberries, and I don't need to add so much later. And the American palate, people are used to a little bit of sugar. So a little bit of sugar, I'm fine with that. But if you want to admit it, that's okay. Go right ahead and admit that sugar. And then I'm going to add vanilla extract. That's one of those ingredients that can be very cost prohibitive. So you don't have to add it. And it's going to be really delicious, I promise you, without it. But if you're able, or your patient is able, and they have it, I really like the flavor addition that adds to this dish, just a kind of depth that you don't quite get without, but it's still really good. So I'm going to go ahead and toss this in the oven. That's it. It's going to have its own juices, so you don't need to worry about that. And then I am going to actually go ahead and pour that liquid from our quick pickle liquid. You can see it's nice and steamy. Ooh, got that vinegar hitting my face. And I'm going to pour that right over each of these ingredients, my onions and my strawberries. You want to let that sit at room temperature for about 30 minutes or so. And after it's cooled to room temperature, you can put a lid on it and put it in the fridge. And it'll store for weeks in the fridge because it's pickled. You know, you get the high acid and that salt that's going to keep it kind of fresh. But I don't want to use that hot. I want to let that sit for a little bit. So, you know, magic of TV, and I made some in advance. And let me just show you these gorgeous pickled onions and pickled strawberries. I mean, look at that. It's a nice addition to salads, sandwiches, a nice little appetizer hors d'oeuvre. Really brings out those natural pigments, the betalains, anthocyanins. Gorgeous, just fun. You know, the acid brings out the color. So fun way to prepare our dishes. And I will keep these available for garnish. We're actually not going to use the pickled strawberries today, but keep them aside for when we do use them. We will use these onions, so I'm going to keep them over here. All right, and then the last prep item I'm going to do is these roasted white beans. Maybe or maybe not, you've heard of some roasted chickpeas. I feel like they've gotten a lot of attention. But you might not have heard of roasted white beans. Maybe you have, which you're lucky if you have, because these are good. I love roasted beans. If I can swap out regular beans with roasted beans, I pretty much always will. So I'm just going to toss these. These are cannellini beans, northern beans, whatever you have available. I like cannellini. They have a little texture to them. A little bit of olive oil, just a touch of salt. Keep in mind whether or not your beans are salted or not coming out of the can. These were unsalted, so I'm adding a little salt to them. I'm doing a little garlic powder and smoked paprika. The sky's the limit as far as seasonings are involved here, so get creative. I also really like some, if you've never tried nutritional yeast, it's a really nice option as well. So I'm tossing these with my seasoning, and then my last kind of fun secret ingredient is cornstarch. And you don't need this, you could certainly do it without it, but cornstarch creates this kind of crispy exterior that you don't quite get without it. It still gets crispy, don't get me wrong, but trust me, you'll see when I show them to you done. The cornstarch just does something really fun. You can do without, though. They'll still be good without. So I'm going to spread these out into an even layer on my pan and just throw them in that same oven as, just put a little parchment, just easier cleanup here. Same oven as my strawberries. For both of these really are 20 to 30 minutes, so I'll just keep it high. And I don't know how I did this before, but Alexa's going to help me. Alexa, set an alarm for 20 minutes and let me know when we're almost done.
20 minutes, starting now.
Thank you, Alexa. All right, so I'm going to let those go. The beans are best used really the day of, if able. But I do find if I store them at room temperature and I want to reuse them, say, the next day, if I pop them back in the oven for another 5 minutes, they usually actually turn out pretty crispy. So that's a quick tip for you. But they're great as an option to add as a crunchy option to something like salads like we're going to do today. But they're also a great snack. And, you know, for those people that might crave a crunchy, salty snack, I think they are an excellent option. Okay. So we have our roasted strawberries, our onions, and our white beans done. And now I'm going to show you how to use those ingredients. So through the magic of TV, I already made some because they're going to cook for about, like I said, 20 to 30 minutes. We should be done by then. But I made some earlier. And I'm going to show you a few recipes. First I'm going to show you is a cottage cheese. You know, for a while I was feeling like cottage cheese wasn't getting any love anymore. But it's actually become viral again on TikTok, I'm hearing. I'm not very active. I think my oven's making a little noise. I'm not very active on TikTok, but I do hear a little bit about it, and there's been a lot of viral cottage cheese recipes, so apparently cottage cheese is in again, which is great. I love cottage cheese. I love the flavor of it. I think it's, you know, available in a lot of places, and it's packed with protein. It's literally packed with protein. I think half a cup might have gosh, I want to say 15 grams of protein or so. So pretty simple recipe here. I'm just going to add cottage cheese, half a cup. And then I'm going to put those roasted strawberries. The vanilla goes really well. If you didn't add vanilla to the roasted strawberries and you have vanilla, it would go really well here. And then I am going to top it with some of those toasted almonds. Now, I gotta tell you, first of all, this is so good. I knew it was gonna be good making it, but I didn't expect it. This is probably my favorite recipe of the day. It just I don't know, it hit me in a way that I didn't expect. And I can literally eat this for breakfast, for snacks, for dessert. Something about the way the cottage cheese, the strawberries, the nuts all work together. It just really, and the vanilla, truly, just really, really works together. So it's a nutritional powerhouse and it's delicious. It's loaded with vitamin C. Just so you know, a serving of strawberries, which is about 8 strawberries or a cup, has 95% of your vitamin C needs. And this dish has about 70 because we didn't use quite a cup, but still 70% of your vitamin C needs. And then it also is loaded, it has a good amount of iron coming from the cottage cheese and the nuts. So that's vitamin C is going to help with the iron absorption. It also is a good source of folate. It has potassium in it. And this to me is like a better version of a fruit on the bottom yogurt, which by the way, yogurt's a great substitute here and might be what a lot of people use and have available. I just want to show you something a little more fun and, a different way to have this. This would also be great on oatmeal. And you can also just use fresh strawberries. I mean, a little fresh strawberry or will go a long way with that. One thing I forgot to mention, I did this yesterday, just drizzled literally like half a teaspoon of honey on here, just on the top. 1, it makes it pretty. And 2, just have a little punch of honey. Really, really brought out the best of this dish. So I could eat this all day. And it's simple. Once you have those roasted strawberries ready, it comes together in a couple minutes. All right. Next, I'm going to show you a strawberry toast. Get my ingredients here. And this is another fun way to use cottage cheese. And this might be a good option for those that may not like the texture of it, but still want to get, the other benefits, including the calcium and protein and such that comes from it. And here I'm going to actually blend up the cottage cheese. You could do yogurt in here, cream cheese would work. You also don't have to blend it, but you could literally just mix ingredients or layer them and it would still be just as good. But like I said, I like showing you a new way, a way to kind of make it creamy that you might not have thought of before. I don't know if a lot of people have thought of blending cottage cheese. Okay, so I'm adding cottage cheese, just about a teaspoon of honey, just a little bit goes a long way. Other sugar substitutes would go well here too. And the last thing I'm going to add is lemon zest. I like the zest, the kind of oiliness of the zest, the flavor of the zest. You can do lemon juice too, but I'm actually not using it. I'm going to save that for later. Just put my lemon back in the fridge. And I'm only going to zest about half of my lemon here because I'm going to save the rest for a little garnish on top because it'll look pretty and you'll get a little bite of lemon zest at the very end. Okay, so I have my lemon zest. I don't need to add salt. You probably know cottage cheese is actually fairly high in sodium, so we do need to take that into consideration for people who may be salt sensitive or need to limit it in their diet. You can always, like I said, use something like yogurt. Might be a good option for them. And there are some lower sodium options available, not always easily available everywhere. So I'm going to use an immersion blender to blend this up. You can use a blender, you can use a food processor, and like I said, you can literally just mix it and it'll be just fine and delicious, but I wanted to show you how to make it creamy, so I'm going to make a little noise for a minute. for me. And easier for me to clean them out. Okay, great. Move this back over here. And I have this nice creamy version of cottage cheese. Ricotta would also work really well here. Again, I was just trying to find something available and approachable for everyone. Next, I'm going to cut up just some fresh strawberries. This would also be really good with the roasted strawberries, but I wanted to show you a few different options. I'm just doing a thick slice on these, 2 to 3, depending on the size. It's going on toast, so, you know, you can be able to bite it. You can also quarter them. However you decide to cut them is fine. Yum. So we're getting about half a serving of strawberries in this one. Okay. And then I have these ready. And then the last thing for my garnish I'm going to do is chiffonade a little bit of basil. If you haven't seen this before, it's just a pretty way to make little ribbons. I'm growing this in my garden. Any herb would work. You could also omit the herbs. But I think growing herbs is a great way to incorporate lots of flavors, nutrition, and it's pretty affordable, and your plants just keep giving. So I did that a little too fast. You're going to stack your leaves on top of each other and then roll them up into a little tube. And then just slice across that into thin little strips. And this is our chiffonade. You can also just rip it if you don't want to do that. You could also just do some small leaves. But that's just a fun way to do our basil. And I'm going to do this. I got a nice whole grain sourdough at the store. You can literally just use regular bread. And this will be delicious. You might toast it. You can decide to. This is, it's crunchy on the outside and soft on the inside, so I didn't feel the need to toast it. I'm just going to cut off a nice thick slice of that bread. And I'm going to do a schmear, a nice little schmear of that lemon honey cottage cheese. Do a nice thick layer on the bottom. And then I'm going to put the rest of this into a container. This could make 2 servings. I'm just showing you one here. Okay. And then I'm going to add my strawberries. How pretty is that? Ugh. Can't wait to eat this. I'm not going to lie. I'm going to do my basil. And I'm also going to do some pickled onion. It's going to be a nice salty tart hit. I thought about adding a salty cheese, which would also be a great option. I probably wouldn't do that and the pickled onion because they kind of have both have that little salty punch. Look how pretty that is. Look at all those colors. It's like we're celebrating nature's bounty on this little delicious bite. And I'm going to add some of those toasted almonds. That'll be a nice little crunch on the top. A few more. And then, for the fun of it, because it's delicious and pretty, I'm going to do just a touch of lemon zest on the top. Get a little of that. You taste it when you bite into it, but you also see it. It's in the little yellow specks. And I like a little fresh cracked pepper, so I'm just going to do a little fresh cracked pepper on top. Look at that gorgeous toast here. This is like a meal in itself. It's just a little over 300 calories. It's a good source of calcium, vitamin A, vitamin C, vitamin K, the B vitamins. It has 15 grams of protein, And just like all these other dishes, you know, they have that good blend of fat, protein, and some complex carbohydrates, so it's going to help you feel satiated. It's also a good source of fiber. It's 5 grams of fiber coming from things like those strawberries. I really think strawberries and cottage cheese and these nuts are just like nature. They're just like a perfect combo. They're delicious and they provide so much nutrition. So, you know, strawberries themselves are a really low calorie, low sugar food, but there's actually also research to suggest that they may help reduce blood sugar levels. So for someone that might need to watch, you know, their blood sugar, especially with the fiber added, this is going to be a really delicious, really good option for them. Yum. Okay. And I think we're almost out of time here, and that's good because we're almost to our last dish, which is a summer salad. And this is a fun way to use those roasted strawberries. Okay. So here I'm going to use the same container because it has pretty much the same ingredients, and I didn't want to dirty another container to make a dressing. And I'm going to make a creamy strawberry dressing, and using those roasted strawberries in it. So I'm going to do a half a cup of strawberries. And then I'm going to add balsamic vinegar, which goes really well with them. I'm going to add a little bit of that cottage cheese. It's going to add protein and some creaminess. You can do without the cottage cheese, and this will still be really good. But I have it. It's a fun way to use it. Some mustard. It's going to add a little tartness throughout, but it's also going to help bring it together. And then I'm doing some garlic powder. You could do shallots, you could do garlic fresh in here, you could omit it, you could add herbs. Again, you could do other vinegars, you could do yogurt, you could add avocado. I mean, really, there's limitless pairings. Once you figure out how to make a basic dressing and what goes into it, there's limitless combinations that you can do there. And then I'm going to add just a little bit of honey, again, about a teaspoon. You need that to balance out the acidity, but not a lot. Okay, so about a teaspoon. I always like to do it on my spoon first, just in case I do too much. I'm going to do a little bit of black pepper and just a touch of salt. I don't need a lot because there's already some in that dressing, and I'm going to get it from other ingredients. So really just like a little pinch of salt. And then I'm going to take that same immersion blender and blend this all together. Okay. Beautiful. I think this is the perfect viscosity, but if you find it's too thick, you can add a little water to it. You know what? I actually forgot to add a little olive oil. I like adding that olive oil for some creaminess. You can omit it. Look, it still looks really good. But I also like it for the monounsaturated fats. So let me just blend that olive oil in there too. Try to mix it right in. But I'll do this to make it blend it a little better. It'll emulsify a little more. All right, look at that. Oh, gorgeous, gorgeous pink dressing. So fun. All right, so look at that pretty dressing. I love that. And this will stay in your fridge. You can make it ahead of time and just have it available. It's good on sandwiches, it's good on salads, it's good for dip. Multiple options here. So we have our creamy roasted strawberry dressing. You can, figure out how to mix it up with different seasonings to make it fun. And I'm going to put that on a salad. And, you know, if people tell me they like salads, usually I think it's because they just have had salads that are really boring, but I'm convinced I can make them like a salad by showing them something more exciting. And so that's what we're going to do here today. It's a fun salad. We can really mix it up, literally. Okay, I want to show you this because I'm using romaine today. And I like romaine in this because I like the crunch. It's one of my favorite lettuces for that reason. It's also a nutritional powerhouse, just like all of our leafy greens are. But you can use any lettuce. You can use any arugula, spinach. You can use leaf lettuces. But I want to show you, I really like to store my salad greens right in my salad spinner after I clean them and drain them. I store them in the salad spinner in the fridge, and I find they keep fresh a lot longer. So there's a quick trick for you. Way to keep your salad greens fresher longer. And also, it generally works better with your heartier greens, like your leaf lettuce, rather than, you know, like spring greens. They might get a little more bruised from that process, so I wouldn't recommend it so much. Okay, so I have my lettuce here. This is going to be a huge, bulky salad. It's really going to fill us up. It's going to hit, gosh, it's, of everything we're making today, this is like a nutritional powerhouse. You'll see on the nutrients when I talk to you about you. But it's also a really great meal. It's a little over, 400 calories. It has a ton of fiber. It's going to be delicious. It's really going to fill you up. And I find a lot of times people don't think salad fills them up because we're not adding enough protein, we're not adding enough fiber. And here, we don't have that problem. So I have my lettuce in here. I'm also going to add some fresh strawberry. So we're doing strawberries 2 ways. I think sometimes people forget that strawberries are really great in these savory applications and add a hint of sweetness. And even, you know, that sweet tartness that strawberries are known for. I really like that in this recipe. I love adding strawberries to my salads. So if you don't do that a lot, I think we tend to do a lot of spinach and strawberry salads, very traditional, but you can really get out of your comfort zone and add it to any salad. With the ingredients I'm putting in here, I think the strawberry goes really well. So you can get creative with that. I'm doing almost a whole serving of strawberries. You know, that's a great way. We talked earlier about trying to get people to eat more fruit in their diet. I'm all about incorporating things into dishes we're already making. So why not incorporate fruit into our lunch or our dinner or whatever this is, which is exactly what I'm doing with this strawberry. So, you know, let's find ways to add fruits and vegetables to things we're already eating and up them. We're making a salad already. We may as well do that. That's my timer. Alexa, stop. Let me just check on these. Ooh, they look good. All right, let me show you this. See our roasted strawberries. Those look awesome. They got like a little char from being roasted and some of that great little jus there, like a syrup. And then look at these gorgeous toasted, roasted, crunchy white beans. Oh, I love these. All right. These to the side. Turn off my oven. I don't need it anymore. That was simple. Not hard at all. Okay, and then let me finish quartering these strawberries and adding them to my salad. I think I missed. No, I didn't. All right, toss that right in there. And I'm going to add those white beans. I had some that I already made that are cooled down. I don't want to put them hot. It'll kind of wilt everything. So you can hear how crunchy those are? Maybe I'll try one. So good. Okay. These are a great substitute for croutons. And then I'm going to add tuna. Great seafood option. And I think so much we think of tuna salad or like tuna casserole. I grew up not liking canned tuna, largely because I don't like tuna salad, like with the mayonnaise in it. But I found when I add it just without the mayonnaise with just some acid into my dishes, I eat tuna like this in salads all the time. And I love it. So this is great. It's accessible no matter where you live. We have canned tuna everywhere. It's you can get it in bulk. Let's not underestimate the value of adding canned tuna, or salmon would work well too. You can use fresh seafood in this as well. You can also omit the seafood completely. You can add other proteins. You can just use the beans for protein, which is another great option. I just wanted to show you, multiple different examples of what you can add in here. And let's see, what else we're going to add? Oh, pickled onions. I love these because they add a little tart crunch, pretty tart crunch. Drain them there into our salad. Usually I would season my salad with salt and pepper, but because I have so many ingredients that already have salt in them, I'm not going to add more today. I will do a little pepper though. I like pepper in everything. And I like hot sauce. Sometimes I'll add a little sriracha in here as well. And since I have basil, I love adding fresh herbs to my salad. I just think it adds a little pop of freshness you can't get. You don't have to. You can totally leave this out. But I have the basil here. Any, parsley, cilantro would work well here. I'm just going to rip these leaves up. Even a blend of herbs would work well. Just add them to my salad. Why not? Fresh herbs are delicious in salads. I think sometimes we forget that. And then I'm going to do my dressing. This is going to be a tossed salad. I like to toss it because I want everything to get covered. I'm just going to do a 1/4 cup of this dressing. And then I'm going to use some tongs to lightly toss this together. Don't be too rough on it. You don't want to bruise all the beautiful ingredients you had in here. You know what I forgot? My toasted nuts. Let me add some of those in there too. And a nice little crunch. It's a lot of textures, just what we're looking for in salad. It has texture, it has great flavors, it has sweet, it has sour. And then of course it has the nutrient profile we're looking for. It has a ton of protein. It's just 30 grams of protein in this dish. I mean, it's loaded with protein. It has 12 grams of fiber, almost half our daily needs of fiber in this one dish. It's a great source of omega-3 and monounsaturated fat coming from the tuna and the oil, olive oil, and even some in that cottage cheese. All right, let's put that on here. And also the nuts, obviously, have some healthy fats. So this dish is like, I don't know, it's a nutritional powerhouse. And it's heart healthy, it's delicious, and also, as an added bonus, clinical research has suggested that the addition of strawberries can actually help reduce total cholesterol levels. So the strawberry just has an added benefit in this dish. So beautiful, gorgeous, delicious summer strawberry salad with strawberries two ways, our delicious California strawberries. And that wraps it up. So actually, let me show you these 3 gorgeous dishes. Let me give this a quick wipe here. We got our summer salad with strawberries. We got our strawberry toast. I'll show that to you there. It's just so pretty. And then we have our cottage cheese dish. We use strawberries. We use cottage cheese. We use toasted almonds. Even our pickled red onions across these dishes. And so we really incorporated those culinary medicine principles, and we talked about alternatives that we can use, things that we can omit. And this is going to be delicious. You're going to feel good eating it. And it's going to be good for you. So thanks so much. And after this, we'll leave the kitchen and I'll be able to take some questions with you. Appreciate y'all being here.
Thank you so much. All right. Well, thanks for sticking with me through that video, because cooking really is culinary medicine practice. So hopefully you got a few tips and tricks from it. But putting everything that we've gone over through this video and today, putting it into practice, we want to address individual barriers to healthy eating and, of course, provide resources such as recipes, handouts, shopping lists to make it easier. Start small with our patients, and like I did in this video, cross-utilize ingredients whenever possible to minimize waste and keep it approachable. While you're at it, don't forget that frozen, canned, and prepared options might be better choices for some people, depending on their lifestyle and budget. And last but not least, make sure it tastes good first and foremost, and of course that it looks good. Culinary medicine is culinary first. We provided you with some resources in your packet. You have the recipes, a toolkit, and some research. You can also visit californiastrawberries.com for some extra resources. And they have some great recipes on there as well. And I'm not sure if we have time for more questions. Leslie can let us know. But I know I addressed a lot of them during the cooking demo. Thank you all so much.
We can take one or two questions if you don't mind. There was a couple that came in about your use of cottage cheese and vegan, people who are vegan or follow a vegan lifestyle. Any comments or alternatives on vegan cottage cheese?
Yeah, there's some really good vegan yogurt products that would work well in these applications. And I think there might also be some vegan cottage cheese products floating out there, but maybe not as accessible as the vegan yogurt options are.
Great. Okay, let's do one more, maybe two. How long do the pickled items last in the refrigerator?
No, I found they last really a few weeks. I always go by smell and sight, but because of the high acid content, they last even longer than traditionally prepared items. So almost like your pickles do in the fridge, they'll be good for a few weeks at a time if stored properly.
Great. Perfect. All right. Well, I think that wraps it up for today. Thank you so much, Leah.
Thanks, y'all. I had a great time. And if you have additional questions, please don't hesitate to shoot me an email. I had a lot of fun doing this, and strawberries are obviously an easy subject. So thanks to the California Strawberry Commission, and thank you all for asking such great questions, and of course to today's dietitian for having me.
Yeah, fantastic. And yeah, we echo the sentiments, Leah. Thanks to California Strawberry Commission. We had Chris Christian, the Vice President of California Strawberries, on the line as well, helping to answer some of your questions through the chat feature. So I hope we got all of those answers out to you in a timely fashion. I would recommend everyone reach out to Leah and check out californiastrawberries.com for more information on yummy strawberries. And so finally, your attendance certificates should be available to download. You can follow the instructions on the screen or refer to the final slide in the presentation handout for information on how to complete the webinar evaluation and access your certificate. The slideshow, the slides were PDFs, and the accompanying handouts, health data, the strawberries toolkit, and all of the recipes were emailed out earlier today. These will also be included for download in the credit claiming email that will get sent within the next 24 hours. And so with that, we've come to the end of the hour. Thanks everyone again for joining us. Thanks Chris Christian and the California Strawberry Commission, and thanks Leah Sarris. Have a great day and a great remainder of the week.